Hey everybody, it's Jason. For those of you that don't know me, I am Jennifer's husband. I talked with Shane briefly about making a little video about coronavirus, COVID-19, and kind of what I'm seeing as a physician who's helping care for some of these patients. And so I just wanted to share some stuff with you. Overall, the chance that you will have coronavirus is really small. Even there, the chance that you will have issues and need hospitalization is very, very, very small. Not to say that you should not be vigilant, and certainly be careful about washing your hands and social distancing and cleaning surfaces and areas that are frequently touched. All those are good ideas all the time, and especially in this time. The patients that typically are in the hospital that get hospitalized, and unfortunately some die, but those patients are very, very typically sick with other comorbid issues, meaning that they have other health issues, typically lung issues, COPD, emphysema. They're elderly or they're morbidly obese. Those are some of the big risk factors. Excuse me. But for most folks, the people who are healthy, people who take precautions, unlikely to get coronavirus. And so just want to kind of let you hopefully know that and I'm treating folks who do have coronavirus who are doing well and who will be discharged from the hospital and who just had some shortness of breath and a fever and did well. The symptoms that we talk about typically are the ones you've heard about: the fever, cough, and shortness of breath are kind of the cardinal symptoms, so to speak, of coronavirus. But those are, can be seen in anything. Because you have those doesn't mean that you need to be in the hospital or that you need to even come to the emergency department. The main reason you would need to come to the emergency department or get hospitalized would be if we need to do something that you can't get at home. For example, if we need to provide you with supplemental oxygen, that would be something that you would need to be in the hospital for. But just because you have a fever or just because you're a little bit short of breath does not mean you need to actually come to the hospital. Now, if you have one of those comorbid conditions, then certainly you need to have a lower threshold. And always, if you do have a specific question, you should always check with either your physician or you can check with me as well. You're free to let me know, if you think you have symptoms and you would like a physician to have a look at you. Contact your own if you want. You can contact me. You can Facebook message me, or you can text me, or you can call me. If you don't have my number, you can check with Shane, and he'll give you my number. I'll be more than happy to evaluate you, see if you need to come to the emergency department. But I just wanted to share with you that we're going to make it through this, and it's not as dire as many are that you hear are talking about. It is obviously a pandemic, and it's something that we need to take seriously, and we need to do our part to be smart and, like I said, wash hands and social distance and try and be mindful when you're around other people and not coughing on them and things that we should do anyway. I just wanted to hopefully provide some reassurance, and I wanted to remind you as well of the fact that we're Christians, and we know that God is sovereign over all of this, and we have not been given a spirit of fear. 2 Timothy 1:7 says that we have not been given a spirit of fear, but of power, of love, and of sound mind. So we have nothing to fear. We have a gift that we can give to other folks who are scared, folks who are worried about what's going on, that we know that God is sovereign over all of this. And it doesn't mean that we can't help and be active and proactive in doing things for others, but we have a gift of hope that others don't have, and we need to be ready and eager to share that. So I just want to encourage all of you. And again, if you have any questions or anything, you can contact your physician. If you are worried about possible symptoms, or you can get in touch with me, and I'll be more than happy to check you out. Hope all is well, and take care. Bye-bye.